Hello, everyone. It's an honor to join you for the first Pediatric Dermatology Congress in Buenos Aires and welcome you to the plenary session on psoriasis and vitiligo. Before we dive into the patient journey map, let's take a moment to refresh our perspective on vitiligo and set the stage for how this tool can be a valuable asset in your practice. Let's get started. Vitiligo is a multifactorial systemic disease with unknown origins, characterized by the selective loss of functional melanocytes, leading to unpredictable and progressive loss of skin color and, sometimes, the color of overlying hair. But vitiligo is now understood as more than a skin disorder. What a dermatologist sees as a white patch is only the tip of the iceberg. Vitiligo is linked to various organ-specific and systemic disorders, including ocular and auditory conditions, autoimmune diseases, metabolic syndrome, and mental health issues, as you can see on the screen. Melanocytes aren't just in the skin, they're also present in the eyes, inner ear, and even adipose tissue. This indicates that comorbidities associated with vitiligo may stem from melanocyte damage in these areas as well. Understanding this broader impact helps us connect the dots between skin manifestations and deeper health implications. Vitiligo affects about 0.1 to 1.5% of the global population, yet up to 40% of cases may go undiagnosed. The latest data shows an incidence rate of about 50 cases in children and 65 cases in adults per 100,000 person years, which is similar across age groups and between sexes, and this trend has been rising recently. In terms of prevalence, dermatologists report it affecting 0.7% or around 37 million of adults, and 0.3% or about 6 million of children. However, self-reported numbers are even higher, 1% or just under 57 million adults, and 0.4% or almost 9 million children are living with vitiligo today. Geographically, the estimated lifetime prevalence is ranging from an average 0.2% in East Asia to 0.3% in Andean Latin America, and to 0.5% in both South Asia and Central Europe. But keep in mind that these numbers may exclude a significant portion of the population living beyond the reach of healthcare systems. Vitiligo may seem harmless at first glance, but it impacts patients far beyond the physical, emotionally, socially, and economically. Patients often talk about how vitiligo disrupts their daily lives, especially when depigmentation appears in visible areas, or on those with darker skin tones, where the contrast between normal and depigmented skin is much more noticeable. For example, among people with lighter skin tones, up to 25% of patients experience clinical depression or anxiety, but for those with Fitzpatrick 4 or darker skin tones, that number jumps by 10%. And that's only scratching the surface. Children are even more vulnerable, facing increased risks of anxiety, eating disorders, and in severe cases, even suicidal thoughts. While some, like supermodel Winnie Harlow, have embraced their unique skin and achieved incredible success, the majority of people with extensive or highly visible vitiligo struggle with the emotional toll it takes on their quality of life. Economically, patients with vitiligo can spend up to $8,000 more per year than their healthier counterparts, and that's not even considering the costs related to mental health, lost work time, and missed job or dating opportunities. Despite advancements in understanding vitiligo, it remains a complex condition to manage, often requiring year-long treatment plans and multi-year follow-up protocols. Let me introduce you to Olivia, a strong and determined vitiligo patient in her mid-20s, living somewhere in suburban America. Born with the most popular name of her generation, Olivia has battled non-segmental vitiligo for more than 10 years. 7 patches, mostly on her face and neck, now cover more than 5% of her body. Despite a family history of thyroiditis, Olivia had no awareness of vitiligo in her relatives. At just 14, she waited 3 months to see a doctor, only to hear, "Don't worry." That left her in limbo for 8 years. This reflects the 37% misdiagnosis rate in the US, which is still lower than Europe's 45% and Africa's 56%. But Olivia didn't give up. She tried 6 self-prescribed treatments she found online, with little success and some side effects. After 18 months of searching, Olivia saw 3 different doctors nearby before finally finding a vitiligo specialist in a neighboring state. And here's the staggering part. 46% of doctors in the US still consider vitiligo untreatable. The percentages are even higher in Europe and Africa. Olivia's story isn't just about the visible changes. It's about navigating the emotional challenges, the stares, the uncertainty, and the tough decisions along the way. Her journey is shared by so many others, and understanding her experience is crucial if we want to make a real difference for vitiligo patients. Now that we've covered the basics of vitiligo, let's step back and look at the bigger picture. Patient journey maps have been used in healthcare for some time, typically outlining the path from symptom onset through diagnosis, treatment, and follow-up. But in reality, this journey is rarely that linear. Patients face misdiagnosis, seek second opinions, encounter mistreatments, and experience dropouts and relapses. What's more, traditional maps often don't reflect the best options for the patient if certain treatments aren't available at the hospital. They also overlook the emotional, behavioral, and lifestyle factors that deeply influence patient decisions. Most maps are provider-centered. But what if we flip that and put the patient at the center? We'd need a map that shows every option, highlighting the full landscape, best routes, decision points, pitfalls, and even the estimated time to destination. Most importantly, it should be pragmatic yet optimistic, a tool that brings clarity and hope to patients who may already feel overwhelmed. After multiple iterations and input from 3 designers, we've done just that with a touch of humor. This map provides a bird's-eye view of the vitiligo journey, giving patients a clear sense of time, direction, and what to expect along the way. In the initial phase, our goal was simple: to create a prototype grounded in a deep understanding of the patient journey through the healthcare system. To get there, we used a mixed methods approach, analyzing 982 patient records from our bio-IT system, running an online survey targeting 8,000 patients, and reaching expert consensus. This gave us a full-spectrum view of the patient experience, from symptom onset to long-term management. Now, here's what we found. The median age at diagnosis was around 30 years, with an average disease duration of 11 years. Disease progression varied widely, as 6% experienced no progression, 32% saw slow progression, while the majority faced medium to rapid progression. What's more, over 40% were misdiagnosed initially, and care was fragmented. Patients saw an average of 2.3 specialists over 7.8 months just to get answers. This data paints a clear picture of the challenges we face. Let's explore how we used it to shape a better solution. Armed with this aggregated data, we created a mind map that lays out the most common treatment and non-treatment outcomes for vitiligo patients. We identified key touchpoints, what we call stations, and placed them along the patient journey. Each station represents a critical moment where patients engage with the healthcare system or their community. Some of these moments are what we call moments of truth, where the gap between the ideal experience and the reality becomes painfully obvious. We structured the map along an x-axis with 3 emotional phases: white spot, beautiful, and spotless. These symbolize the emotional journey patients go through at different stages. Initially, we considered adding a y-axis to represent triggers or causes of vitiligo, as you can see on the left side of the screen, but ultimately chose to simplify the visualization for clarity. This prototype wasn't just thrown together, it went through multiple rounds of refinement, with the team carefully working to get the relationships between each element just right. The goal is to make this map as clear, impactful, and easy to understand as possible. We used a familiar layout inspired by a New York City subway map, with color-coded lines representing different aspects of the patient journey. And we added a dash of humor in the names to make managing vitiligo feel less overwhelming and more approachable. First, we identified 3 key areas. The Highlands in light green, representing the traditional healthcare path. The Foggy Bottom, a whitish zone where patients explore self-help and alternative treatments, and multicultural Long Island in beige, focusing on non-medical options like cosmetic solutions and mental health support. The journey starts at white spot to your left, where patients first notice symptoms. From there, they can move toward spotless on the right, symbolizing successful treatment, or toward beautiful, reflecting self-acceptance and non-medical management. Along the way, various stations and connections, many marked with timestamps, illustrate how differently patients may progress through their journey. The spotless station, located in the farthest right corner of the map, is served by the green treatment line. Along the way, patients stop at Dr. Google, Family Doc, Dr. Bright, and finally, Clinic. On average, patients consult 2.3 doctors and take about 8 months to reach the clinic. From there, the line splits into yellow sublines, each tailored to specific vitiligo subtypes. The Lights line, Laser Express line, and Home line use phototherapy for repigmentation. The Meds line works best for non-segmental vitiligo on the face and torso. The Surgeon line handles stable, unresponsive cases, while the Holistic line is best for slow-progressing depigmentation, focusing on lifestyle changes like reducing emotional stress or avoiding aggravating chemicals. The Experimental line explores late-stage trials and custom therapies, and the Aesthetics line offers medical makeup or depigmentation, guiding patients to beautiful station. All these lines converge at Early Bird and Almost There, both on the dark green maintenance loop, the final stretch before reaching spotless. It's tempting to pause at Early Bird to make up for lost time, but this can be risky. Many patients drop out after 4 months, finding it hard to fit in 2 to 3 clinic visits per week. This is a missed opportunity, as consistent treatment could lead to near-complete clearance in 11 months. Once patients reach Early Bird with about 75% improvement, sticking to the protocol for another 3 to 4 months is critical to achieve near-perfect repigmentation. A short break of under 12 days might require minor tweaks, but a month-long pause can undo progress, potentially sending patients back to the clinic via the dropout and mistreatment line marked in red. Even after reaching spotless, the journey isn't over. With over 40% of patients relapsing within 4 years, regular monitoring and using the maintenance line is essential for maintaining results. Now, let's turn to the middle section of the map, Foggy Bottom, served by the Wizard line starting at Dr. Google. This area is home to characters like the dubious Dr. Foggy, a mystical healer, and an enthusiastic dietitian, well-meaning, but ultimately lacking the expertise to manage vitiligo effectively, no matter how convincing their arguments might be. Typically, the first stop is the self-help junction on the vicious circle, where patients attempt to self-diagnose and treat their condition through nutrition, cleanses, or fancy diets. Many end up here because vitiligo specialists aren't easily accessible. Unsurprisingly, they remain stuck on this cycle of misguided treatments for about a year before deciding to get off at broken hopes to reevaluate their situation. However, feelings of failure often cause hesitation, and it can take up to 4 months before they accept a referral from social media and hop on the support line to the support group station. There's a slim chance that a dietary or lifestyle change might actually improve their symptoms. The lucky few may find themselves on the dotted lottery line, arriving at Almost There within weeks. But because they never consulted a true specialist, they'll never know if they even had vitiligo or another underlying condition. Inevitably, these patients end up zooming through the station, straight onto the dropout and mistreatment line, back to the clinic. The Long Island area spans from white spot to beautiful, offering numerous no-treatment and self-care options. It's served by 3 main lines, cosmetics, emotional, and social lines, running vertically on the left side of the map. The social line starts at white spot with a stop at the social media hub, where travelers learn to embrace their uniqueness before heading straight to beautiful, where you'll find many familiar faces, including celebrities, politicians, athletes, and movie stars. For some, the quickest route to beautiful is cosmetics line, which includes camouflage, self-tanning products, or clothing, though some opt for medical-grade makeup via the aesthetics line for longer-lasting results. On the emotional line, the first stop is futon, which splits into the family line and self-acceptance express line. The family line loops through the counsel's office or a holistic doctor, connecting to the support group. The self-acceptance express often passes through a religious setting, labeled temple, over a period of 6 to 8 months, but not always. All right, let's wrap this up. Every traveler needs a map, and I wish I'd had one when I began my own vitiligo journey nearly 50 years ago. From a patient's perspective, this map gives a bird's-eye view of the healthcare maze, highlighting key milestones and offering a sense of the time it takes to navigate through it. It's important to remember that the journey varies widely depending on the individual and the country. Vitiligo patients often see multiple providers, pediatricians, general practitioners, dermatologists, and even mental health counselors, each with their own approach. Sex differences also shape experiences, making men and women's journeys different. Now, here's what I suggest. Take a good look at this map, or better yet, put it up on the wall where others can benefit from it too. This map is released under a Creative Commons license, translated into 10 languages, and it's yours to use. Print it, hang it in a clinic or support group office, and let it start conversations with those just discovering they've joined the 1% Club. Remember, a map doesn't just show you where you've been, it helps you see what's possible. And that's where the Real journey begins.